would like to share some of my insights and experience in caring for older adults who are living with obesity. And as Greg mentioned, so I am a practicing nurse practitioner. I work in the endocrine inpatient service where we manage folks with very complicated endocrine disorders, much of which are type 2 diabetes, type 1 diabetes, and I see a lot of individuals who are struggling with their weight, and I've had to work with folks who are considering also bariatric metabolic surgery. So I'm delighted to speak with you today. You know, everybody in this room has probably had some experience with this, and so really the focus is to discuss some of the options and considerations for older adults. And in making sure we are up to date with literature review, it is not surprising that a lot of current evidence and research that we have is very limited because we often just look up into age 65 and we stop enrolling older adults in a lot of these studies. So I will be sharing with you several studies that I did find, as well as some other considerations that I think are clinically relevant. So as we all know, obesity is a global problem, and it has been linked with more than 40 diseases, most notable being type 2 diabetes, heart disease, stroke, and cancer, which are some of the leading causes of preventable and premature deaths. So bariatric metabolic surgery is an option for adults and older adults. So just to review, hopefully this is a review, when we think about the World Health Organization, or WHO, and thinking about the classification of weight, we often look at BMI, body mass index. And BMI is fraught with a lot of issues. It doesn't take into consideration gender, it doesn't take into consideration ethnicity, it doesn't take into consideration where your adipose tissue is it peripheral, is it central? So there's a lot of things that is problematic with using BMI. The problem is we don't have anything better right now. There's nothing really better, and all studies are using BMI, which helps us with comparison purposes. So when we look at overweight, we look at a BMI between 25 and 29.9, and obese being greater or equal to 30, and then we have different classes, class 1, 2, and 3, 30 to 34.9, 35 to 39, and then greater or equal than 40. And the NIH recommends that we should be considering bariatric surgery for patients who have failed medical weight loss interventions, who have a BMI of greater than 40, or for those who are greater than 35 with comorbidities. I will tell you that the American Society of Metabolic and Bariatric Surgery has been pushing the idea also of considering bariatric surgery for individuals who are type 1, class 1, I should say, class 1 obesity, because this is the time when people are really developing their comorbidities, and why would we want to try to get out in front of that and try to offer those solutions to individuals. So there's been this big push also to be thinking about surgery for the obese class 1. With older adults, there's also the problem, the fact that with aging, we also have reduction in height. And so as our older adults have vertebral changes, they reduce their height, that changes the denominator in our BMI formula. So if someone weighed 250 pounds, was 5'8", and lost an inch, their BMI now goes from 38 to 39, and it may not necessarily accurately represent their risk per se. So that's another issue for older adults. Obesity impacts every body system. Every body system is impacted. So we can't think about this as, well, don't worry about it, it's not going to impact this body system. It actually impacts everything. And so just like this cartoon depicts, sure glad the hole isn't on our end as we're bailing out the water. The reality is obesity really does impact every body system. Most notably, it has been linked with type 2 diabetes, hypertension, dyslipidemia, heart failure, coronary artery disease, and cardiac arrhythmias. and obstructive sleep apnea. And there's a whole host of pathophysiologic reasons why that is. And I often use this particular slide with my own students to show that this is a very complex situation, and many things are interlinked and connected. So as far as trends in the United States alone, we are steadily increasing over the years, and you can see that on average we have a 42% obesity rate in our country. And among adults aged 60 and older, it's about 42.8%. So older adults are living longer, and they're heavier than past generations. So this is a very different change in how we've had to manage in the past. We'd always have concerns about underweight, but now we have concerns about individuals being overweight and obese. When we look at older adults, we often see numbers when one gigantic category, greater than 60. That's a wide range of folks. So this is nice to look at this from 2007 to 2010. You can see the breakout 65 years and older, 65 to 74, and 75 years and older. And notice men are dark blue, women are light blue, all is green. And we can see that in those middle years, 65 to 74, there's significant increase in the prevalence of obesity. And then as individuals age, we can see that that does drop off. Again, when we look by race and ethnicity, we can see here there's 3 different columns in the different age groups for both men and women, and you can see that there are even increasing numbers depending on different ethnic and racial groups, and that's another consideration as healthcare providers. We need to be thinking about what are environments of care, what are situations where we can help individuals, because when we're talking about bariatric surgery, we have to think big picture. It's not just one and done, we have surgery and it's over. We have to think about living environments and social situations and social support. So this is no news to anybody in this room. So our population is aging, and with that, the proportion of older adults who are going to be living with obesity is also going to intensify as well. We're already struggling as a health system as it is, and we need to be teaching our students who are going into this profession how to take care and manage not only the complexities of aging, but now adding in additional factors of complicated diabetes and obesity, and thinking about functional abilities. If individuals are living with obesity, how are they getting around in their environment of care? How can they age in place or be safe, prevent risk for injury or falls? So something to consider. Its problem is only going to escalate. So for those of you who've printed out the notes, I just want you to just be forewarned. There's a couple pictures in here that were not in your packet. But we have, as a society, been long obsessed with weight. We're all obsessed with weight. And we have tried for centuries, how do we manage weight? We're very creative. So you can see here we've had ads where buy our soap, our obesity soap, will melt the fat away. Just use it regularly and send us $2, and we will ship that out to you. We also think about tapeworms. People used to buy tapeworms, and you could ingest these, and then you consume as much, as this woman in the ad said, as much as you'd like, and you'd be just fine and lose weight. No risk at all, and easy to swallow. Also ads, if you're craving something, reach for a Toasted Lucky cigarette. It'll take away your cravings, and you won't get, it'll help you from, quote unquote, getting fat. The difference between this woman can be a stick of gum. And then we found that some medications or drugs or chemicals can also help you lose weight, like arsenic. So arsenic would make you sick, and then you couldn't eat. You were so busy with nausea and vomiting, you'd lose weight. Of course, it's very effective that way. And then Dr. Kellogg, our Kellogg cereal producer, was obsessed with health and fitness, and he was a big believer in regular yogurt enemas for weight loss. Sign up for that. We have, I don't even know what was medicated about these rubber garments, but these medicated rubber garments were to help you lose weight, even in the 50s and 60s. Continue on, maybe you wouldn't lose weight, but will make you look thinner. And just when you thought that was bad, the 1970s is the sauna hot pants. Will help you lose weight. And of course, we all seen these pictures, these fabulous machines. We're certainly not fool enough to buy anything like this anymore. How could this possibly work? But you can get it on Amazon for less than $100, something similar.